Hi, it's Dr. Travis Whitney with the 8 Healthcare Institute, and today we are going to go over a demonstration on how to prepare umbilical cord mesenchymal stem cells. So we're going to start by going back, getting the cells out of the freezer, and so I can go get them. We have a special cryo freezer that keeps them at around -87 degrees. And then what we do when we thaw them is you put them in a specialized water bath over here. That's at 37 degrees Celsius. And then that way it thaws them out at a proper speed and temperature. Because if you do it too fast and too high of a temperature, all the cells will die. So this is just gonna be a demonstration purpose, how you can prepare these cells, how we can use this in some sort of, even like an emergency or ambulatory setting, how quick and easy this can be. And then we'll go over how to prepare them for different administration methods versus if we're gonna, use a medicine like this intravenously, if we're gonna do something like this and use it for an orthopedic procedure, or there's several different ways you could administer them. So they're in the ice bath, or they're in the water bath. This will take about a minute or so to thaw, depending on the size of the vials. There's different ways you can store these cells. You can store, around 25 million in a little 2 ml vial, which you'll see here, or there's bigger vials where you can store more of them. You just don't want to crowd too many cells in. So we'll just keep checking them, making sure that they're not getting too warm too quick. I like to thaw them. When we thaw them here, I like to thaw it just almost 100% thawed to where there's maybe a little bit of ice left. And that way when you draw them out, you can always put a little saline in there and it'll thaw the rest of it really quick. And then at the end, what we'll try to do is we'll try to just capture a sample. This is an Naloxone salometer. And then we also have this Countess 3, which is a fluorescent staining. We'll do this one because it's faster and easier and cheaper to do. And that way we can see some of the cells, and we'll see a viability count and a live cell concentration. And this one is an old one that we have on here already, that we can get a zoom in of a little later. And what you'll see is it's a little crowded right now. So in this cell sample, it was a lot of cells we were using. So we'll try to get a smaller amount of cells so that we don't crowd the microscope. So let's see how they are doing. So that one, you can see it's probably about halfway thawed now. There's a little iceberg left in there. But this is one of the nice parts about umbilical cord derived stem cells is you can take an umbilical cord, you can extract these cells, you can put in food for the cells, nutrients, growth factors, a cryopreservative. We use trehalose. Another common one is dimethyl sulfoxide, which is called DMSO. But people have been noticing a lot of sensitivities to DMSO as a preservative. So we use trehalose, but you can preserve these cells. You can freeze them. They'll stay frozen for decades. Cryopreservation has been around for a long time, and I guess I'll spend a minute addressing that as well. There's a lot of myths going around in the stem cell community that the only way to prepare a stem cell preparation is fresh, which would be taking a cord, growing the cells out from it, and then harvesting and capturing them right there from their growth media, and then using it for a treatment. It's a very timely, very lengthy process, has a higher risk for contamination. And so a lot of clinics are starting to market that they do fresh stem cell preparations. And some of them, I don't think they really are. But that's on them. So I know for a fact some of them aren't. And so a lot of clinics in Mexico and overseas are marketing this, trying to get people to come into the clinic. And having representatives say things like, these are dead cells, and the only way you can administer a stem cells is to only do it fresh. So we'll show you that the cells, you can still capture cells very nicely using cryopreservation, and this makes it for very easy point of care. So clinics, hospitals, and everything can have this set up, and it doesn't take very long to do it. So normally I would be doing this with a mask on, but for the purposes of filming, of course, I'm not going to wear a mask. So let's see if we can see some of these cells in here. You'll see a little bit of turbidity. I don't know, can I come in? You might see a little bit of turbidity down there at the bottom. Oh, it's a little yellowish. What I'm gonna do, let's see if you can capture this. I'm gonna take this pipette. Let me know when you're ready. Focus down there on the bottom. I'm gonna suck up a little bit of the fluid, and I'm gonna inject it back in, and you'll see all those cells from the bottom kind of poof up. There's a good clump of cells right there. And if I pipette those, they'll start to break up. There we go. So what we want to do is we do this a few times, and we really get them broken up off the bottom of that vial. I wasn't 100% ready. I need a falcon tube. You want to give me a falcon tube? And then what we'll show you is after we add all these to what we call a falcon tube, it's a little tube with a cone on the bottom. We'll spin it in a centrifuge, and then we'll show you all those cells collected down at the bottom. And it's quite visible once you get into the high hundreds, even 100 million. You'll be able to easily see the pellet. Angela, you want to go get the rest? The other 200. So this should be this should come out about 100 million cells. There's different ways you can store them, but we do about 25 million per one of these vials, little 2 ml cryo vials. And you may have seen other ones come in a rubberized container. And those are mostly the commercial products that they have to do for safety and sterility. But you don't want to keep cells in a rubberized container like that if it has cells in it. Most of those commercial products, because they fall under FDA laws, they can't have live cells in there. And so what we do is we put some saline in the bottom, and that'll get all the leftover cells. Because there's definitely cells in the bottom. Once you get that initial draw up, we did this a couple times. We did a couple little experiments where we drew all the cells up from the first passage, the first draw up, and then in a separate tube, we put the rinse, what we call the rinse, adding some saline in there and getting what was left. And there is definitely tubes at the bottom. There's definitely cells at the bottom of the tube. That was a good one. So it looks like, kind of just looks like a little jellyfish down there. So you really want to take your time when you do this. Kind of try to speed it up for filming purposes, but overall this could take 10 to 15 minutes easily, depending on the number of cells that we're administering. So this is a really simple setup that I think we could have at point of care locations like hospitals, and you don't have the process of going through a surgical procedure like a bone marrow extraction or an adipose extraction, which is basically like a liposuction. They extract the fat out and then they have to harvest it and process it, or they'll hammer or drill into your bone back here in your hip, what they usually call your hip is your pelvis, and they'll suck out some bone marrow and then they have to extract cells out of it that way. So you don't have to go through all that for these for something like this. You can have the cells frozen on site. They're quick to thaw. You could be talking to the patient. You could be doing other kind of treatments or forms of care for them while this is being done, which is what we'll commonly do. We'll have a patient giving some IV medicine or something while we're going through and doing all this. And let's see. So Angela has the rest of them thawing. We're gonna do 300 million today. And this is alcohol, isopropyl alcohol, for those that are trying to be funny. A 70% alcohol solution. This just helps sterilize our hands and the area. So normally we'd spray everything down with alcohol, including these, while we're prepping them. And the cells are very visible when you're actually using a good high amount and live number of cells. As I'm mixing this up, you can see the cells distributed through the saline, floating around. And that's important when you're doing an IV administration. We use a special filter to break up a lot of those clumps before administering them intravenously. So for filming purposes, it's a lot easier to do this preparation right here instead of under a hood or in an enclosed environment like the lab. I just thought it'd be fun to see and to educate and show people how this process is done, and also highlight how easy it could be to have this implemented in other places. Oh, that was a big one, big clump. Let's see if we can see that pellet get broken up again. We try to get them as broken up and as diffuse as possible. And what's nice for something like orthopedic procedures is you can draw something like this straight out of the vial for an injection. So using this in the athletic community in the professional sports injuries, I think has a ton of applications, especially if an athlete gets injured on the field. You could start administering these right away back in the clubhouse or in the locker room, or I'm sure professional places have little clinics or something where you can do this, but would dramatically increase the healing time and the rehab on athletes. And there's not a ton of special equipment that you would need. And any sports medicine doctor would be able to do this and administer it, draw them up, do a quick injection, clean the site area, and be really easy. Okay, one more. Okay. And now what we're going to do is we're going to centrifuge these. So we want to make sure that both of these are equal in volume. And that's so the motor on this machine that spins these around really quick doesn't get worn out. And if it's too off balance, it'll shut down. It has an automatic little safety feature. I think that's pretty even. Take this balance out. Okay, so this will get spun for about 5.5 minutes. And in the meantime, you can tidy up, you can get ready to do your cell sample if you're gonna do one. Do one. Let's chat. So this is a trypan blue staining solution, 0.4%. So we're gonna get some of this. And then we're gonna mix some of the cells in with this. And it's going to stain the walls of the cells, and it's going to allow this microscope to read it. Oh, you know what? Can you hand me that paper, Angela? I'll tell you what, while we're waiting, we'll make a separate video on this, but I thought this would be a good time, since we got a few minutes, to address the legality of stem cells. So I'm gonna read, because I printed off, or I typed up this eloquent version of of the legality of stem cells in the US, because we get calls on it all the time. We get people in different social media groups reaching out to us, and they all want to know, well, I thought I had to go to Mexico or Panama, or I thought stem cells were illegal. I keep hearing stem cells are illegal in the US. So the FDA doesn't like, or doesn't, they don't want commercial products having stem cells in them for commercialization and selling and distributing. So they have a rule where you can't manipulate or grow the cells and then sell them. So what we're doing here is different. Everything that we produce is for an experimental medical procedure. It's for our patients only. We don't sell them to anyone. We don't sell them to other clinics. We don't sell them to, hospitals or distributors or anywhere else across America. So this is my conversation with our lawyers. And so I'm just going to read this to you, and it'll summarize the legality of umbilical cord stem cells in the US. So, in general, the FDA has no jurisdiction over physicians and clinicians. The 10th Amendment of the US Constitution regulates the governance of healthcare to the states. The federal government has almost no authority over how physicians treat patients, including with stem cells. Where the trouble comes in is a lot of clinics market improperly, and that's where the FDA and the FTC, the Federal Trade Commission, will come in and say, you can't say these stem cells will cure your arthritis, or these stem cells will cure or treat or anything. So they have a lot of stipulations when it comes to what you can say about stem cell medicine. So let's see. So both the FDA and FTC have authority to punish medical practices for making public advertising claims about unsafe, untested, or unapproved procedures. So stem cell procedures is still not approved by the FDA. However, they still have no authority to take action against a physician for counseling a patient within the confines of a consultation. The key issue in this situation is whether the patient fully understands the treatment, the risks involved, and has given proper consent. If this is the case, the treatment has at least reasonable scientific validity for the physician to recommend the treatment. The FDA still has no authority to take action against the physician. Let's see. So we talked a little about the distribution of stem cell products. So a lot of commercial labs, they make, they call them stem cell products. I don't think they're doing that anymore. Back in 2017, 18, that was going on a lot. Now I think they refer to them as biologics. But they'll take something like an umbilical cord or a placenta or some amniotic fluid, and they'll extract growth factors and cytokines. Basically, if you gave stem cells a bath, they'd collect the bath water from that. And it got very misleading as to what was a stem cell procedure and what wasn't. So that's what the FDA really doesn't like. So it does boil down to the state and that doctor's medical board and what they're allowed to administer to their patients. In Arizona, I am licensed as a naturopathic medical doctor. So our state medical board allows the administration, or allows us to use regenerative medicine. I think it's termed regenerative medicine, biologics, or cell medicine. That's in our laws. So it's done spinning. So let's take a look at what it looks like. You saw what it looked like before. It was a little turbid, just a bunch of fluid. And then so now when we get out, you can see overall, it's a lot clearer, the liquid is, because all these cells have been pushed to the bottom. And now we have this huge pellet, what we call That's what we call a pellet, and that's all the cells collected down there at the bottom of the tube. And then so we'll go in there and we'll break that up even more. Let's see the other one. So one you can see on the right is the one where we clearly used, I think, 8 of the vials.
200.
Probably like 200. And then this is the one where we'd use the rest of them. I can't remember where I split it. I think it was like 5 and 7 or something, because this one was getting too full. So you can see the difference as clearly which one has more cells in it and which one doesn't. So let's take the smaller one and let's break this up. So to get rid of all that fluid that we really don't need, I'm gonna get a syringe and an 18 gauge 3-inch needle. So and one of the problems is in the States, I will admit, is the overuse of the commercial products. And so if you were to spin, and we did do it, we have done it. If you were to spin those commercial products, you wouldn't get anything like this on the bottom. There's no cells in there. There may be some dead cells. So you just get rid of all that excess fluid that we don't need. And depending on what kind of procedure we're doing is how much fluid we'll add in or leave in. But I want to leave enough just so that we can break up this pellet and show what that looks like. Let's just show what it's like to break that pellet up. See, I got a little clump of it. Cool. Like a little jellyfish. Jelly. That is a lot of cells. I actually probably didn't even leave enough fluid in there to break all that up. But the more we do this, the more those cells will start breaking up from each other. And you can already kind of see them dispersing. And then you'll just kind of have like a thick, cloudy kind of appearance of a mixture. So that's actually too many cells to use for a sample. I think that would crowd the plate. So what I'm going to do is draw up most of these. I'm going to add a little more saline in. Let's see if I can use that for a sample. Wow. Let's take a 10 microliter sample from this. So this is just taking a little 10 microliter sample out of that first, what was it, 100, 200 million cells that we had in that first Falcon 2, and then staining it with something called the Trypan Blue, 0.4%, and then adding it to the slide. And then you can see, you hit counted, it has this little feature where it'll show a lot of the green ones as the live ones. The red ones tend to be dead, or at least, like in this case, clumped together so much that it can't count them. You could see some other ones clumped together so much here that it's not picking them up. Depending on the size, this Countess 3 is a lot, the fluorescent staining one is a lot nicer because you could set different parameters. But 94% viability, so 94% of the cells from that sample are alive, and you could tweak it a little bit. You could probably get that a little higher, a little lower, depending on how you adjusted the focus. But that was pretty much a cell demonstration. And what you could do, you know, we could take these, we could run them through a filter, and we could use them for an IV administration. We could take something like this and mix them with the patient's plasma or platelet-rich plasma, use that for an orthopedic procedure. For neurological conditions, we can do what's called an intranasal procedure, where we take a specialized catheter and we thread it back through the patient's nose and we insert them that way. So lots of different applications. I hope this was educational and informative for you. If you want more updates on what we're doing here at Innate Healthcare Institute or umbilical cord stem cell medicine, please subscribe and follow us. Otherwise, give us a like, and we'll see you in the next video.